President, I ask consent to speak as of in morning business, and would the chair please notify me when 20 minutes has expired?
We are in morning business.
Thank you.
Senator will be so notified.
Thank you, Mr. Chairman. Today, I'd like to report some good news about the work of the United States Senate that should be of interest to every single American family. And that is that we're moving ahead in the Senate on a package of 50 bipartisan proposals that will help move medical devices, medical cures, and medical drugs through the long and expensive regulatory and investment process and into medicine cabinets and doctors' offices where they can help patients. We call this our Innovation Project. It's a companion to work that's been done in the House of Representatives already, which they call their 21st Century Cures Act. It's also work that the President has talked about, President Obama, in important ways. And the reason the House has already done its work, and that the President has talked about this in his State of the Union address, and that we in our committee, the Health Committee of the Senate, have been working for a year to develop 50 bipartisan proposals, which we hope to bring to the floor of the Senate, is because we have never had a more exciting time in biomedical research in America today. We're talking about actually curing some cancers, Mr. President, not just treating cancers. We're talking about using 3D printing to actually help replace knees. I was in a medical device office in Memphis a few weeks ago, and that company told me that in 1/3 of the cases where it sells knee replacement equipment, it also sells a tool to the doctor so that if he's replacing the knee of the senator from Oklahoma, the doctor, he or she, uses this tool that's just made especially for the senator of Oklahoma's knee, and it virtually eliminates the possibility of a mistake by the doctor in that surgery. The company told me that it not only uses 3D printing in 1/3 of the cases, but that it could easily do it in all the cases, and expect it will soon. At our hearing about 3 weeks ago, I asked Janet Woodcock, the head of the Food and Drug Administration, if there had ever been a case of 3D printing of a drug, and she said yes. There has been one. They've used 3D printing to manufacture a medicine for epilepsy. That is not all, Mr. President. Last year, when the President announced his precision medicine initiative, he introduced a young man whose cystic fibrosis has been cured by a new medicine. He takes the medicine every day, and if he does, he's cured of cystic fibrosis. And while that only affects some cystic fibrosis patients, the drugs that are used to cure that number of patients are the same kind of drugs that they believe eventually will cure every patient with cystic fibrosis. The President on that day announced what he calls his precision medicine initiative, and that he wanted to assemble 1 million human genomes so that if my doctor is prescribing for me a medicine, by knowing what my genome is and what that medicine has done in other genomes, he can make a very specific sort of prescription, one that's more likely to help me and less likely ever to hurt me. I attended the President's ceremony. I told him afterwards that we would do our best to incorporate his precision medicine initiative into our work in the Senate on our biomedical innovation project. The House was making good progress on his 21st Century Cures project. And so I told the President, Mr. President, I can't imagine why we can't get a result in this Congress. Since that time, the President has announced a cancer task force that Vice President Biden is leading to work to speed up treatments and cures for cancer. The House has passed its 21st Century Cures, and in our committee in the Senate during the past year, we've held 10 bipartisan hearings, including 6 on how to improve the electronic medical record systems that hospitals and doctors are using. We've had 5 bipartisan staff working groups who have met or held briefings more than 100 times in the last year. And the result of their work has been 50 bipartisan legislative proposals. As I said, every single one of those has support from Democrats as well as Republicans on the committee. So today in our committee, we debated and approved the first 7 of these bills, which included 12 of the 50 bipartisan proposals I just mentioned. We had an open process. Any senator who wished to could have offered an amendment. The bills had had so much work on them that there weren't any amendments, but they were important pieces of work. Our committee, Mr. President, probably is the most diverse in the Senate. I know that's saying a lot, but if you look up and down the Democratic and Republican aisle, we span the whole spectrum. Last year, we worked together despite our differences of opinion and produced a bill to fix No Child Left Behind. A lot of people thought we couldn't do that. I expect the same sort of bipartisan effort led by Senator Murray, the senior Democrat on her side, and me as chairman. I expect that to work well for us again. We have a second markup of legislation scheduled for March the 9th and a third for April the 6th. And my expectation is that after we meet these 3 times and consider 50 legislative proposals, that when we're finished, it will all add up to bipartisan companion legislation to the House's 21st century legislation, 21st century cures legislation, and that our legislation will include important elements of the President's precision medicine initiative and his cancer moonshot. Now, the 21st Century Cures Act, the House bill, includes $9.3 billion in so-called mandatory funding over 5 years, mostly for the National Institutes of Health. Several of President Obama's other proposals in his new budget involve mandatory funding, and several members of our committee have talked to me about mandatory funding for some of the work that we need to do. Here is my view about mandatory funding. I don't want to get the cart before the horse. When I was governor of Tennessee and we needed a new road system, people would say to me, "Are you going to raise the gas tax?" I said, "We're not going to talk about the gas tax. There are lots of different ways to pay for a road. You can borrow the money, you can use discretionary money, you can raise a fuel tax, you can build a toll road. We're not going to talk about any of that. First, we're going to decide on what we wanted to do, and what we decided to do was to have 3 big road programs to attract the auto industry suppliers to Tennessee, and it worked. And the decision we made after we decided what we wanted to do was, in that case, to raise the fuel tax 3 times because we didn't want any road debt. So we have among the best roads in the country and 0 road debt, and we've got the auto industry. That worked out pretty well for us 30 years ago. So I'd like to apply the same sort of thinking here. I don't want to talk about how we pay for something before I decide what the something is. Here's the something I'm thinking about. I'm thinking about something called the NIH, National Institutes of Health, Innovation Projects Fund. 5 areas, in addition to the things that we normally fund and do, that require extraordinary support, one-time support, ideas that have a start and a finish. In other words, they're not built into the budget for a long period of time. The National Institutes of Health Director would have the authority to direct allocations of this fund to specific areas of importance. The 5 areas of importance I have in mind are helping the President launch his precision medicine initiative, an American Young Investigators Corps. We've heard from Dr. Collins, the head of NIH, and many others, how important it is to have young investigators, have enough money to give them the money to do their research. The BRAIN Initiative. All of us are staggered by the prospect of the personal anguish that Alzheimer's and other brain diseases will cause individuals and their families. And we're excited about the prospect of relieving that anguish. And we know how much this is going to cost us in the tens and tens of billions of dollars. If we can find a way to develop new understandings of neurological disorders which help discourage Alzheimer's disease or prevent it or deal with it, it saves money as well as saving anguish. A big BioThink Award. Dr. Collins had suggested this in some of his testimony. During this exciting time, let's give each of the 28 institutes and the National Institutes of Health a sum of money and let them identify the most promising big ideas in the country in their areas, cancer, for example, mental health, for example, and fund it. Let's see what comes out of this remarkable country of ours when we challenge them in that way. And then the cancer moonshot. Now that the president and the vice president are involved in this way, we want to make sure that we do all we can to take advantage of curing some cancers as well as treating some cancers. And there may be some aspects of that effort that have a start and a finish that could be part of what I call NIH Innovation Projects Fund. I go into some detail about my Innovation Projects Fund proposal because we may be able to fund these needs in the regular appropriations process. But I am willing to consider using mandatory funding for these 5 areas. Because number one, they have a start and a finish. They jumpstart. They're limited. In that sense, they're not subject to being appropriated forever, as appropriations often are. And second, I believe that we should reduce other mandatory funding in order to use this mandatory funding. We should be about setting priorities here in the Senate. And I cannot think of a more important priority than biomedical research. Now, I mentioned we have 50 legislative proposals about which we have bipartisan support, but we do not have bipartisan agreement in the Senate committee on how to deal with any of these items that is paid for by mandatory funding. Neither do we have enough money within the jurisdiction of our committee to deal with it. So we will deal with both the Innovation Project Fund and the mandatory funding, if that's what it turns out to be, to pay for it, once the bill comes to the floor. We have to decide first what programs we want, and then how to pay for them. We should do that here on the floor. We know we'll have to have 60 votes to do it in that way, if it includes mandatory funding. And we had some experience with that. Last year, we had some very difficult issues with the Elementary and Secondary Education Act. I had one of them, had to do with vouchers. That drives some people on the other side of the aisle up the wall. If I had insisted on putting the scholarships for kids proposal that I had on the bill in the committee, the bill might never have gotten to the floor. Senator Franken, on the other hand, had an important piece of legislation to him on discrimination. But if he'd gotten that on the bill in the committee, it would have never gotten to the floor. We agreed, since we needed 60 votes to get a result, and a result is what we want, and the American people expect us to get, that we would withhold our controversial amendment until the floor and see if we could develop bipartisan support on the floor to have at least 60 votes and get a result. We followed in our education bill the rule that Senator Kennedy, the late Senator Kennedy, and Senator Enzi followed when they were the ranking members of this committee. And that was, let's find the 80% that we agree on and work on that first. And let's take the things we disagree on and do those later. Most important, just as Senator Kennedy did with Senator Enzi, just as the full Senate did last year on fixing No Child Left Behind, we kept in our mind getting a result. I said on the floor many times last year that if all you want to do is make a speech or assert your point of view, you can stay home. You can get your own radio program. You don't have to travel as much. There's no need for you to come to the United States Senate. You can have your say here, but if you really want to do your job here, you can work with other people and see if we can get a result, especially when we're talking about issues that affect every American family in such an important way. So I'm determined to get a result. I'm delighted that I have the opportunity on this committee to work with the senator from Washington, Senator Patty Murray. She's a strong Democrat. She's the leader of the Democratic caucus. But because of her leadership and her interest in getting a result, we were able to succeed last year. And I believe working with her and the other members of our committee will be able to succeed this year. The House of Representatives has done its work. It's passed the 21st century legislation. The president has made his proposals for precision medicine and for a cancer moonshot. He talked to all of us during his State of the Union address in the last 2 sessions. We have worked for a year in our committee to produce 50 bipartisan legislative proposals that should go through the committee and be ready in early April to come to the floor. The majority leader, Senator McConnell, has said to me, and he said to all of us, that even though this is a presidential year and we have less time here, that he's still looking for important ideas that benefit a large number of Americans, that have bipartisan support, and that the president will sign into law. Well, Mr. President, I can't think of a single piece of legislation that the United States Senate could consider this year that fits that definition better than our companion legislation to the House of Representatives 21st Century Cures legislation. Now, I would like to say a word about the legislation that we passed today. As I mentioned, these were all bipartisan pieces of legislation. Let's see if I can find the Senator. Bipartisan. The first one was introduced by Senator Bennett, Senator Warren, Senator Burr, Senator Hatch. It had to do with rare diseases like cystic fibrosis. This is what Senator Susan Collins of Maine said about that piece of legislation in a debate in our committee. If you ask the parents of sons or daughters, primarily sons, with muscular dystrophy who suffer from Duchenne's, a very rare kind of muscular dystrophy, whether this bill that we just approved is important, believe me, they'll tell you that it is. We approved it unanimously. It's ready for the Senate to consider. Senator Burr, a Republican, Senator Franken, a Democrat, offered the FDA Device Accountability Act of 2015. This would help move ahead innovative medical devices, items like artificial knees, insulin pumps for people with diabetes, stents for people who have suffered a heart attack, new surgical tools that can get bogged down in the FDA. In other words, we want to keep the safe and effective gold standard, but we want to get these devices through the system as rapidly as we can at the lowest cost we can so people can afford them and so people can use them. Senator Baldwin and Senator Collins, Democrat and Republican, offered a bill called the Next Generation Researchers Act. We know that biomedical research is our best weapon against diseases, illness, and death, and we can't afford to use young scientists to other countries. So this bill helped attract young scientists by promoting opportunities at the National Institutes of Health. This is what Senator Collins had to say about that. If you ask Dr. Collins whether the bill that Senator Baldwin and I have sponsored is important to attracting and keeping young researchers, believe me, he would say yes. Then Senator Kirk, Republican, Senator Bennett, Democrat, Senator Hatch, Senator Murkowski, Senator Isaacson, Senator Collins introduced another piece of legislation. The Senate Bill 800. I don't have that list. It would help millions of Americans with disabilities, illnesses, and chronic conditions that require them to go to medical rehabilitation. Senator Kirk, a stroke victim, spoke movingly about the importance of that bill. Senator Collins said this morning, if you ask stroke victims whether the rehabilitation bill that we passed is important, they would say yes. If you ask families that are struggling with neurological diseases such as Parkinson's, MS, or Alzheimer's, whether the bill that is on the agenda today is important, they would say yes. There were four other bills that we enacted. One by Senator Isaacson, we did an act that we approved by committee. Senator Isaacson and Senator Murphy on advancing research for neurological diseases. Senator Murray offered a bill to prevent superbugs and protecting patients based upon incidents that had happened in our home state of Washington. And finally, Senator Murray and I offered legislation to improve electronic medical records. Our committee did not set out to deal with electronic medical records, but the more we got into our discussion.
It's time already.
We've used 20 minutes?
Yes, sir. Yeah, the senator wanted to be notified when he reached 20 minutes. He's reached 20. You still have the floor, Senator.
Thank you very much. I'll conclude my remarks. I see the senator from Florida is here. But I would like to say this about the legislation Senator Murray and I introduced. The electronic medical record system in this country is in a ditch. Doctors and hospitals that use it have come to dread it. The administration recognizes that there are problems. They haven't taken all of my advice about what to do about it, but I do give them credit. Secretary Burwell, Karen DeSalvo, the head of CMS, Andy Slavitz, for working with our committee, Senator Murray and me, to try to find ways to make the electronic medical record system something that genuinely helps patients and that doctors look forward to instead of dreading. We have to do this because every other advance that we need to make, almost every advance we need to make in biomedical innovation, depends upon this. Certainly the President's Precision Medicine Initiative absolutely depends upon our getting electronic medical records right. So perhaps the most important piece of legislation we approved today, among those 7 pieces of legislation, was doing what we could do in legislation to get the electronic medical records system out of the ditch, onto a better track, so that doctors use it rather than dread it. And we're counting on the administration to continue to work with us to finish that job. So, Mr. President, this is good news, I believe, for the American people. It means that we're on a path, step by step, to do our part of the job. There was some debate in our committee about whether the bills we were passing was important. I would like to introduce, following my remarks, Senator Collins' comments, which reminds us of why each of the 7 were important, and I ask consent to do that.
Without objection.
There was some talk about the fact that we disagreed about the level of mandatory funding or whether to do it all. We do. We disagree about that. We don't have bipartisan consensus on it. But we do have bipartisan consensus on 50 legislative proposals that we need to move ahead with, and we will move ahead with them. 12 of the 50 were done today. The rest will be done in early March and early April. And my hope is that by early April, the Senate will be able to join the House of Representatives and President Obama and say, here is our contribution to the most important step we can take to make the quality of health better for virtually every American family by passing our companion legislation to 21st century cures. Mr. President, I'll also ask consent to include, following my remarks, a summary of each of the 7 bills our committee approved today. I thank the President and I yield the floor.